Great question. So, in people with good peripheral access, do you need a Cordis, particularly in the trauma setting? Jed, you want this or?
Yeah, I'll start out, and I know all my answers wind up this way because medicine's an art and there's not much black and white, but depends on how sick the patient is. Is this someone I'm going to go rapidly to a massive transfusion? Like, are they bleeding out in front of me? Yeah, Cordis is justified. The vast majority, if they've got 218s in, no, they don't need a Cordis, would be how I would play it.
So I think the real take-home point is stop putting in triple lumens in your trauma patients. You can justify large bore access in someone that's got rock solid, more than one peripheral IV that's big bore. Okay, none of this 22 in the hand garbage. Like we're talking in the AC, we've got 18s. If you got two of those, you're able to give blood products fairly rapidly. If I'm activating the massive transfusion protocol, I'm at least asking the question of why am I not putting a Cordis in this guy? Is there a reason for it? But as long as you've got two rock-solid, large-bore peripheral IVs, it is safe. IOs, if you go to the humeral head, you can get fairly good volume through it, but it's really difficult to get blood rapidly through an IO line. You can do it if the line's great, if you have a really solid IO line, but it's really hard to get 2 units through an IO quickly. It is not hard to get 2 units through a Cordis quickly. And frankly, if they're looking really sick and I'm thinking that they're going to go to the OR shortly, what do you have to lose? They're already going to an ICU setting for a long time. The nurses later will thank you for having this large Cordis access, and you want to be able to put those in quickly. So I have a low threshold, but you don't have to have it. If they look great and you're like, maybe this trauma patient or GI bleeder or whatever might need blood later, but you're not actively transfusing them, 2 big bores is fine. Just don't let that translate into they've got a 22 gauge in their pinky, and that's fine. That's not fine.